Hi everybody, I am doing this tutorial because it was requested sadly several months ago when I took a bit of a break from YouTube because my girl of 10 years, she's about 10 and a half, she'd been with me for 10 years, she was diagnosed with cancer. I had Lyric who had pneumonia, which he fought his way back. I lost Reiki to heart disease and all kinds of things, and I kind of took a step back. But Michelle, I'm so sorry this video took so long, but thank you for asking. I kind of want to show you guys, a bit of the differences between appetite restore and recovery food. I know appetite restore is pretty unfamiliar territory for a lot of people, so I want to kind of talk about what that is. It's basically glucose, B vitamins, and electrolytes with the whole design of getting those rabbits or guinea pigs or chinchilla feeling better in that moment, kind of helping to get their blood sugar up, which can actually help make them feel a little better, get their, in a little bit more of a place to want to eat. Typically that's going to be for those anorexic rabbits, those ones that just don't want to eat for, a significant period of time. But that's this little guy right here. These packets are soon going to look very different. They're going to be more like the full size. In each one of these packets, it comes with less. You see the emergency kit right here, because typically for most rabbits, you're going to get more than one serving. You can see here, this is how I've secured it. I've just used one for this demo, and I can keep the rest. It comes with this little scoop. So for, just to make it simple, whether you have a rabbit or pig, it's going to be one of these little scoops and 3 cc's of water, like this 3 cc syringe here, per pound of body weight. So for a pig, that's going to be about 2, which is what you see here. So between this little dish and the little bit in this syringe, that's about 2 scoops and 6 cc's of water. If you come over here, this is recovery food. So there's a big difference between these two. This one is made to be completely dilute, so it can go straight in and do its job without having to be digested. Whereas this guy over here is going to replace their meal. That is not their nutrition they need. So Appetite Restore is just something to help make them feel a little better. It's also, great for getting them to drink water, things. We have all kinds of uses that people have found for this. We've even had, crazy reports of how, why did this help my skinny pig's skin issues and things like that. It's not a magic potion, but sometimes it does some really cool things and we just don't know why. But versus your recovery food here. Now this is a thicker, it's made larger. The reason you don't see the fine grinds, which granted would be much easier through a syringe, is because those are for vet use. That is for those getting emergency care. So through a feeding tube or something like that. In most cases, you want the larger grains because we want them to get their long stem fiber. So it's going to have a little bit thicker consistency. We tend to make them like pudding. Some people like to make it a little more watered down. Others like it thick. I tend to like it a little warmed up just a little bit, obviously not to burn them, and you can kind of check that on your wrist, but they seem to be more receptive when it's just a little bit warmer a lot of the time. Now, these guys can be very pampered little beasts. I had a guinea pig named Shrimp several years ago he was about 7 and he had some kidney disease. And so it had taken a toll on his appetite. So he was getting recovery food twice a day, every day, just to kind of supplement his diet and keep his weight on. So some days he wanted it from a spoon, other days from a dish, and other days he loved eating it from a syringe. So you just never know. So it doesn't hurt to experiment with that if you're having to use those products. Now, a lot of people get caught up in, the amount. How much do I feed? And I know Sherwood is very vague on these packages, and I apologize for that. And I think a lot of that, though, is kind of to get away from that stressful mentality where you have to get 30 grams right now into their system or their mouths, and they're fighting you, and you're stressed, and they're stressed. And it's to have more of this mindset where we want them to eat. We want them to get enough. If it's a kind of a crisis situation, say there's no blockage, it's very important that it's not a blockage, because you could rupture, their digestive tract if you force feed in that situation. What goes in has to come out. So if they're not pooping and you don't know the reason, you can feel their sides for that firmness and everything, but it's always advised to get vet care first, because stasis, even though people fear that, is always a secondary condition. So I've seen it be because of pneumonia or ear infections or a mystery infection like Reiki had once, where we didn't know if it was E. caniculi or bacterial, so we treated for both along with fluids for a few weeks after that to make sure she was okay, and she did great for many years after that. So it's very important, Buns, my little girl who I lost to cancer this year, she used to routinely stasis before my Sherwood days. And one time, I went to kind of treat, I'm like, oh, she's doing it again. Let's do the normal routine. Well, it ended up being a full-blown pyloric obstruction, which is a blockage. So it meant the opposite protocol. You're not feeding, you're not giving fluids orally. You're doing so, sub-Q and things like that. You're going to do a lot different with a rabbit that has a blockage. And thank goodness she got through that. We got her through, but she was getting radiographs every day. She was getting buprenorphine injections for the pain and all that. So that's a really scary situation. And she went from having those soft, doughy sides to actually feeling like a watermelon at one point. So that was a really scary time. Hopefully you never face anything like that, but just note, they get things like liver lobe torsion and all that. Those aren't things that we can see necessarily. So it pays to absolutely know why you're using this stuff. So this is just a demo. This is not to help you diagnose anything. It's just to show you the differences. If you have a rabbit that's in stasis because they went through a spay surgery yesterday, those are the kind of things that we can anticipate, we can prepare for, and we kind of have an idea what's going on. It's not really a mystery. So here's like the emergency kit. Like I said, this is recovery food. We can even go through and try feeding some of the boys and see what they think of it. But just note, there are some big differences. Now I have, in cases where I've had to use recovery food, maybe in a couple different cycles. So typically you're gonna use Appetite Restore first, and then use recovery food about 30 minutes later. And I usually do that. You can repeat that again 4 hours later. I have done it where 4 hours after, if they haven't bounced back, I will combine them. Say you're both pretty stressed out, you're having to force feed. Maybe you can combine, it'll give it a little bit more banana taste because this is banana flavored, and it will help make that taste even more banana flavored because it's got a little bit in it as well. It does have the motility herbs that are found in our digestive support, so it's helping stimulate motility. But back to, the difference in how you would use it. Again, this is your nutrition. So this is the meal replacement right here. If they're not eating, this is what you need. So if you have nothing else, that's super important. Your goal with a lot of these cases is not to necessarily get as much in them as humanly possible, where to the point where it's almost to the detriment of you and your rabbit or guinea pig or chinchilla, because it can be very stressful. So it's more, like a lot of times in the clinic, you're feeding them and then you kind of write down the measurement of however much that they ate at that time, and then you try again later. It's kind of a similar thing. Now, for me, if you're going through a crisis situation, like say they're even just coming back from stasis, some will handle it just fine and never need recovery food. Others might have a little bit longer, period after where they're kind of laying around. Maybe they're not pooping, they're not wanting to eat yet, things like that. Some do take a little bit longer to recover, and that's totally okay. And if you have to feed them, that's what this is for. It's not necessarily as important that you get all the nutrition that they would on a regular basis. So if you take a 2-ounce rabbit, and this is at just 10 grams, this is one little packet of this between the syringe and the dish. So a rabbit, for example, a 2-pound rabbit will eat generally about 2 ounces of dry food. That's hay and pellets per day. So that, roughly translates to about 57 grams. So if you can imagine each one of these is 10, it would take 5 or 6 of those packets to give them their full nutrition. And if they are eating it willingly, that is wonderful. You can absolutely shoot for that. If you are both super stressed and you only get 20 or 30 grams in them, that is a huge thing. And that goal is to make them feel better, get some food in them, keep their factory moving. I call them a little factory because they do have a very efficient digestive system that needs to keep on moving. So that's when you get all kinds of problems in the works. Once they stop eating, they can get the bacteria buildup, you get the bloat, you get that painful gas, you get, that bacteria is just kind of wreaking havoc in there. They're not pooping, you're not getting the cecotropes, which is those other vital nutrients and all that. So a lot of things can gum up the works, throw in a wrench, and cause a lot of issues. So your goal is to make sure that they're getting some food, getting some water, and keep that little factory moving, because typically if you can get some food in them, they're going to start feeling better with the goal of eating on their own soon. So some will be on this long term. Say you had a 2-pound rabbit that needed daily recovery food because they had a dental abscess or something like that. We've seen rabbits with deteriorated jaws and things like that, guinea pigs as well. You may be feeding this for life. Say they have had all their molars removed and other such situations. You may need to use it every day. That's when you want to feed them the full amount every day, because you're not just trying to get through a crisis. This is their everyday feeding. That's all they're going to eat. So they need that nutrition, and they can absolutely live off recovery food indefinitely if they need to. And I've known rabbits to do that for many years. There's just a lot that goes into this, but we want it as simple as possible. So keep in mind, again, you can experiment. See, I've had, they always say, to stick that, syringe right there where they have a gap in their teeth because they don't have the canine teeth. So you can stick it right there and all that kind of stuff. Some will burrito, some stick it, between their legs, like kneeling on a floor, and kind of hold them with their non-dominant hand and do it, feed them with their dominant hand and things like that. There's all kinds of ways to do it. Some rabbits really will take it straight in. They will love it, and guinea pigs as well. And I just, recommend trying different methods if one is going really crazy, because some of them will react really well. I had a bunny named Diggs who you could just kind of stick the syringe to him right in front of his face straight on, and he would bite down on it kind of ferociously and things. And you could, being mindful of not causing aspiration by shooting it down their throat, of course. You're trying to, get it to them. Some of them will do it incredibly willingly, even when they don't feel good. And that's great. I've definitely seen that. And some will absolutely fight you. And they could love it in normal situations, and they be sick or hurt or whatever's going on medically or in their life, stress or whatnot, that even antibiotics can really kill their appetite. Kidney disease can cause, them to lose their appetite, things like that. So just keep those things in mind. Even if they would normally love the flavor, you may have to work for it, but keep, trying different things. Like I said, that guinea pig liked it, different methods. Every day I would change it up. So sometimes that works. But if you have any questions, let me know. I'll do a little video of maybe one of the boys trying these things out, and we'll see what they think. Again, they're not even a year old. They're super feisty and hyper and have never needed recovery food, and hopefully they never do. But we'll give them a little taste test here. But thank you for watching. And if you have any questions, please leave them for me and I'll get to them as soon as I can. They love hanging out in the bathroom. Here's Mr. Kai. You see Archer over there. Let's try some appetite restore with Kai. What is some? There you go. That is a bun getting appetite restore. Let's try some recovery food. What do you think, mister? Oh, making a mess already. So this is his first experience with it. Probably not too sure. Look at him lick his lips. Anyway. Well, he came back for a second, so that's good. But that is it. Again, any questions, let us know.